राइट सर, तो एक बार फिर से रेडियो सिटी में आपका स्वागत है। डॉक्टर प्रदीप चौबे joining in right here. Padma Shri awardee for his momentous contributions in healthcare, among the first to bring laparoscopic surgery to India, and right now the chairman of the Max Institute of Laparoscopic, Endoscopic and Bariatric Surgery. मैं सर बहुत सारी तारीफों के पुल बांध सकती हूँ. Also the fact is कि बहुत कम होता है कि मेरे को एक डॉक्टर से दोबारा बहुत सारे सवाल पूछने का मौका मिल जाता है. So I'm glad that we're meeting again.
Thank you very much. It's always a pleasure. And, the whole energy in you really makes it very lively. And that is what the purpose of this discussion is.
Thank you, sir. वो एनर्जी आ जाती है जब मुझे किसी नए शख्स से मुलाकात करनी होती है. When I know that I'll get to learn something, I sort of like it. So, सर पहले तो कोविड की एक और वेव और आप निरंतर काम कर रहे हो. पहले भी बोला है, अब भी बोलूंगी, जब मिलोगे तब बोलूंगी. But thank you for taking care of us. Thank you for just being there all the time for us.
Thank you. It has been tough time, but I think we have learned a lot. And we feel very happy and delighted that we could really do something for our patients in the time of crisis. It was a worldwide crisis and pandemic. And yes, hopefully now it looks as if we are going towards a better future where possibly this thing will become endemic from pandemic rather.
उसी होप पे, उसी उम्मीद पे दुनिया कायम है और हम चल रहे हैं कि जल्द खत्म होगा ये. So when I read about you और मैं पढ़ती हूँ कि एक mammoth record है 90,000 plus laparoscopic surgeries का जो आपकी और आपकी टीम ने बनाया है. It's a record of 100 next generation robotic surgeries in just 10 weeks. So much so, what has inspired you, to start with, जो आप open से laparoscopic surgeries की तरफ आए हैं, 30 years of vast experience. What has been your inspiration all this while?
Well, I think, I am a surgical oncologist, means we're dealing with the cancers and cancer surgeries, right, and trained from Memorial Sloan Kettering Cancer Hospital in New York. And our surgery used to be very extensive and very painful because there used to be long incisions. There used to be long surgeries, and the patients used to be sedated. And somehow, in heart of my heart, in spite of the fact that we were doing very radical surgeries, I wasn't too happy when I used to meet the patients in the evening, because right, you have, it's all mutilating surgeries, I would say. And in back of my mind, there was always a point where when can we reduce their pain sufferings,
Right.
And I knew that there was not possible. But way back in 89, there were four, when I was in US, I realized that there were four surgeries presented for gallbladder. And those were at that time known as the vitoscopic surgeries, And they showed these patients walking after a few hours and being discharged. And it just triggered my, my thinking that this is the way forward we would like to have. Though it was complex situation where you put 3-4 punctures inside and you have telescope, you have the camera inside, you have the light source inside, you have the instruments inside, you have the laser, cautery, all instruments of destruction, constructions, everything is inside. And camera is giving you the view on the television. So that was very exciting. And when we used to see these patients smiling in the evening, I mean, your day is made, right, however hectic the day may be. So that joy on the patient's face motivated me to move on. And when I came back to India 30 years back, that time I thought I was one of the first one to start. Not, I think a couple of us, we started at the same time, but we realized the potential. And that time it was mainly for the gallbladder stones, but soon we realized that, we are going to go way, way, way far from gallbladder. Then we moved on to appendix and, solid organs, spleen, kidney, liver, and moved on to, so I think, for hernias, very common hernias, the uterus, the hysterectomies, and the pelvic surgeries for the ladies. So I think it has got a tremendous potential. And I would say this is something like a computer. So this is something like a smartphone. Whatever you want to use over a period of time, I think we have that thrill of operating with these instruments, and of course creating, and that's why those were called as kind cuts of the surgeon. Because
Yes.
before that, the surgeons were never kind to the patients. At least on surface, it looked so.
I really liked when I was reading about you where they say that you're also called the surgeon of kind cuts. मतलब बहुत कुछ नया हमें भी सीखने को मिलता है. And obviously the cuts have gone छोटा with time, and I think patients भी थोड़ा कम डरते हैं जब उन्हें पता चलता है it's not going to be so extensive. Sir, जब robotic surgery की बात भी करते हैं, the next generation robotic surgery, what all procedures can be covered under it? I mean, if we can just talk about them briefly.
No, I think you see the robotic surgery has been there for a couple of hours for us, right? But I think we were using those systems of the previous generation for very few cases like prostatic cancer and uterine cancer, and like it was more urological procedures and oncological or cancer procedures, But last year we acquired this new generation robot, the next generation robotic system. And this is known as Versius system. And it is made by CMR at Cambridge, UK.
Right.
And this gave us a great push towards using this robot for common surgeries like gallbladder stones, for hernia, for uterus, for GERD, fundoplications, hiatus hernias. So now what has moved? We have in last year and this year, we have moved from the very few limited procedures to common surgical procedures. As we know, gallbladder is very common, hernia is very common, uterine problems are very common. So now we are doing these operations through the robotic system. And this is the new Versius system, which is the next generation robot.
Sir, when you talk about hernia and gallbladder, also there's a thought in my mind, and I've seen people often around me also complaining कि gallbladder का issue है, delay कर सकते हैं, डर लग रहा है, बाद में करा लेंगे. So any message specifically for people who are suffering from gallbladder hernia, surgeries delay करते हैं जो लोग, उनके लिए?
I think I would like to be very, very bold in my statement that whatever disease we have, we should get rid of the disease.
Absolutely.
So if somebody has got a gallstone, we have seen so many complications coming. The gallbladder perforating, having pus, the stones going down, producing jaundice, pancreatitis, and it happens in few seconds,
Yeah.
The stone moves and everything just go. And also, we should also realize that genetically, Indians are prone, genetical coding for cancer of the gallbladder. That is also there. And I think in my mind, with all the 90,000 surgeries and maybe a couple of lakhs of these patients which we see, I have realized, and in my view, the diseased gallbladder, for that matter, just you spoke about that, the stones in the gallbladder, they are like a time bomb. They are just ticking.
Yeah.
They are unexploded bombs. Right. So by any stretch of imagination, we should not let the bomb explode and then act,
Yeah.
So this is my fundamental way of looking at it. And this is my, without any ambiguity, I advise my patients, what you're waiting for? You're just waiting for the bomb to explode.
Absolutely.
Nobody wants to be operated. Nobody wants to have a disease. Nobody wants to go to the hospital. But with this robotic surgery and micro-laparoscopic surgeries, these things have become like any other day-to-day activity. The patient, most of them, they are admitted in the morning, operated. By evening, they can go back. There are no stitches. There's no restriction to the physical activity because the punctures are so tiny. Then you start driving your car next day. It just depends on what you want to do. You don't have to come back to us. 5 days later, just pull out your dressing and be on your own. And this is a curable disease. I feel that anybody who has got a disease which is curable, maybe by medicine, maybe by surgery, is the lucky one.
Absolutely.
And we should not lose this golden period. The golden period of a disease is when the disease is diagnosed, when the disease has not caused any complication.
Yes.
and the disease can be cured. So this is a golden period of any disease for that matter, and we should not miss this golden opportunity.
सर मैं इंटरव्यू के इस कट को स्पेशली काट के ना अपने उन फ्रेंड्स को भेजूंगी जिनको मैं ये समझाती हूँ दैट डोंट डिले एंड लाइक यू सेड इट्स अ गोल्डन पीरियड. और जो ये देख रहे हैं वीडियो प्लीज समझिए, जो भी चीज क्योर हो सकती है, अगर डायग्नोज हो गई है, कोई भी डिजीज है लाइक सर सेज, उसको सॉर्ट कराएं, गो टू द हॉस्पिटल, गेट योरसेल्फ चेक, get it removed. So when we talk about the robotic surgery, just curious to know what are the the unique points about this robo जिसके बारे में हम बात कर सकते हैं.
You see, I think first of all I would say robotic surgery, why we are so excited about robotic surgery. So when we moved from open surgery to laparoscopic surgery, we lost one dimension. So open surgery is the 3-dimensional surgery. Right. Then we moved on to laparoscopy for the last 30 years, and we continue to do that. That is a 2-dimensional surgery. We don't get the depth perception.
Right.
With robotic surgery and robotic cameras, we get the 3rd dimension and the 3D perception. So you can imagine for the last 30 years what advantage we lost.
Yeah.
Now we have regained that advantage by doing the robotic surgery, apart from the fact that all the laparoscopic advantages continue to be there. So it's a huge difference. Now, another point is this Vercius system by CMR, Cambridge, UK, is that this is a mobile unit. So if we have, say, for example, I'm working in Op4 operation theater. So I move one case and we move the whole robotic system to another operation theater. With the previous generation, the robots could not be moved so easily.
Right.
So this is a very mobile unit. So, our number of cases, you can do more every day. That is another point. And while we are operating, there is a console. If you see this console on my background, you are sitting and operating. You're not going into the cave. The previous generation had the tunnel. Yeah. So the surgeon had to put his head inside. So you loses, in a way, communication, looking at the patients, the other doctors, the anesthetist, and you may not be able to communicate with the team, though there is a speaker inside, but you feel little, what should I say, claustrophobic in the tunnel. Here it's everything is open. You can communicate, you can talk to the anesthetist, you can talk to your surgeon colleagues, you can look at all anesthesia monitors, how much is the pulse rate, how much is blood pressure. So this is, and you're sitting like this, you can stand up and this unit goes up, you can stand up and operate. And what you are doing is you're using your, wrist. And another advantage is that we don't have to use our shoulder or elbow. It's only the wrist.
Right.
And this particular movement itself rotates about 720 degrees of the instrument. So you can see that accuracy goes up.
Yes.
The precision is there because of the 3-dimensional. The depth perception is there. We know how far we can go. And that also increases the speed of our operation because of the 3-dimensional. You are not handicapped.
Yes.
So this is the future of so-called laparoscopy and common surgical procedures. I'm sure a couple of years down the line, we will recollect our discussions today and we'll say, yes, I think a couple of years back, we said so.
I wonder after a few years when we have a conversation again, हम कहाँ और पहुँच गए होंगे? Like my dad says, वाह क्या time आ गया है. So obviously cutting edge for science, for medicine, for technology. What's the vision for the future now?
Now my vision is that I think more and more hospitals and more surgeons should acquire this new technology for common surgical process. And here I would like to, because many times somebody will say, oh, robotic surgery was there. Yes, it was there, but it was there and it was used for oncological cases and very few surgical procedures. But now my aim is to pioneer this aspect of the robotic surgery with this Vercius system to make it commonly available to everybody, as I visualized 30 years back about the laparoscopic surgery. When 30 years back, everybody used to say it's only for rich, very expensive gadgets, very expensive instruments. But over a period of time, I'm sure, things will go down, things will become cheaper also. Look at when we started mobile phone, we were paying 16 rupees per minute, you know.
Yeah.
Look at now, where are we? Everybody is carrying the smartphone. So
Yes.
this is what my vision is. And this advantage will go to definitely will go to our patients for safer, more accurate, and more precise surgery. And also will help our surgeons because we are getting three-dimensional and getting a wider range of, our wrist is restricted to this, but the robotic wrist is 720 degrees, you know. So we get that tremendous advantage of doing with more comfort and with more ease.
Absolutely. Sir, you're such a renowned doctor yourself, and it's such an honor to talk to you. There's a lot of fine doctors who've been trained by you in minimal invasive surgery. आप ये अब आगे robotic surgery भी train करने वाले हैं, पढ़ाने वाले हैं. How do you plan your cycle now?
Yeah, well, I think, you know, between last year and this year now, this our Max Institute at Saket has become the international center of excellence for robotic surgery, and also a training center for Asia Pacific and Middle East. Wow. So this is a great advantage. I love teaching. It's my passion is to teach. I just don't want to be known as a magician. I would like to be known, you know, as a teacher rather than, you know, because magicians will keep their tricks within them. I would like to impart this. I would like to share with as many people as possible so that this technology is available to many more patients across the globe, across the country, to many surgeons who will get inspired, will train with us, and will provide safe surgery to their patients.
Fantastic, sir. That's going to be my golden caption today. I don't want to be a magician. I want to be a teacher. I teach too. And I always say I find immense joy when I meet students and I train them on radio. So it's always a pleasure talking to you, sir.
Thank you, dear. Thank you so much.
Before I let you go, how do you keep yourself motivated, like spirited every day?
Well, yes, I think, you know, your motivation starts from the day that you have got a long list and the evening is satisfying. And when you see your smiling patients, that takes away all your tiredness and, you know, fatigue, and you rejuvenate yourself. And of course, when you go back to your own family, because I am a little family person, so when you go back to your family, you get rejuvenated. And in a small way, we are the art collectors. So you look at your own collection of art, sculptures, and be with the family. My daughter plays piano, my son plays drums. Wow. And my wife sings, and she herself is an artist. So I think it makes a good ambience for relaxation as well as getting ready for the next day challenges.
Fantastic, sir. Let the music play always in your life like that. Lots of art, lot of artists in the house. वो positivity वैसे भी आ जाती है. Thank you, sir, बात करने के लिए Radio City पर, and I hope to see you soon again, sometime.
Yeah, thank you very much.
Thank you.
Outside the hospital, always better.
Always better, sir. Always up for a coffee. मैं आ जाती हूँ self-invite करके.
Yeah, and maybe anytime, and maybe it will be pleasure to have a cup of coffee with you and your team.
Thank you, sir. We've taken that very seriously.
Bye-bye.
Yes. Thank you. Have a great day, sir. Bye-bye. Bye, sir.